Thanks.
Thank you, Kate, and thank you, everybody. Rachel Banks here, Public Health Director for Multnomah County, and I use the pronouns she, her, and hers. I'm joined today by Dr. Jennifer Vines, our Tri-County Health Officer, and Kim Taves, our Communicable Disease Director. And we're here to talk with you all today to provide updates on where we are in our reopening plan and to ultimately update the dashboard that we unveiled last week that shows our progress on meeting the governor's criteria. We are also going to talk about contact tracing and testing, some of the most important criteria that we see on the governor's plan. And I want to pause though and just really acknowledge the impact that COVID-19 has had here locally and around the world. The impacts to individuals who may be feeling anxious or a sense of grief or longing for things to go back to the way that they were, the impact for businesses, the impact for families who may be taking care of somebody who's sick, and just for all of us as we are in these times that are so uncertain. And knowing that this is especially hard for folks who have lost their jobs and are struggling in other ways. So our goal is to get folks back to work and back to their daily life as in a way that is as safe as possible and with as many precautions as we can put in place. It's been challenging for us to move safely and think about reopening with this evolving pandemic for a variety of reasons. And one is that the virus spreads easier than we initially thought. With no vaccine and no cure, we want to move forward thoughtfully and in a way that makes sure that our most vulnerable communities are protected. So the governor's stay-at-home orders did stop the spread of a lot of disease because as we were away from each other, there's less options for the virus to spread from person to person. But we know that any lifting of physical distancing requirements increases the chance that the virus spreads and increases the chance that more of us are in more places together. And that has a special impacts on folks who are most likely to get seriously ill from the virus. So we're working quickly to make sure that we can meet all of these criteria and begin reopening here in Multnomah County and making sure that as physical distancing is loosened up here in Multnomah County, that we can quickly isolate the disease, we can find out where it is, we can isolate it, that folks who are sick have a place to recover that's not exposing other people, and that we can stop any more spread than is necessary. So where are we with that? We're making great progress. There's a great team of folks working very hard day and night. And so first of all, we are, our first responders here in Multnomah County have all self-reported that they have adequate PPE. So we are going to be moving that metric from in progress to met. Secondly, we have uploaded our narrative. So one of the requirements for reopening from the governor's plan was that we had at least 3 narratives in place and how to deal with outbreaks in various settings. We've updated, we've actually put out 4 of those narratives. And so we are going to move that from in progress to complete. And last week when we unveiled the dashboard, we knew that we wanted to do a deeper dive to understand what impacts for our Black, Indigenous people of color, what impacts reopening has on them specifically. And so we added additional criteria to ensure that we were reopening in a way that was equitable and not causing further health inequities. And one of those metrics was for hospitalization. So last week we had met that hospitalizations were going down for people over a 14-day period. And this week we're able to report, we've looked at that data for Black, Indigenous people of color, as well as every demographic group. And that metric is also going down for communities of color. So we will mark that as met. Just to add additionally that based on conversations that we've had with community leaders and coming up through our networks of cultural liaisons, we've heard some of the specific strategies that people think need to be in place to protect Black, Indigenous, and people of color, and we will be unveiling a draft reopening plan this week. So once again, we're going to mark that as met. I do want to acknowledge what might be on people's minds, that our sister counties in Clackamas and Washington have released dates of reopening and submitted plans. And I'm here to tell you that today we are not releasing a date for reopening or a specific date in which we will be submitting our plan to the state of Oregon. We're working with our board and our chair, ultimately, Chair Deborah Kafori, to determine what the plan and what the date should be. And this is especially important in Multnomah County, where we have 20% of the state's population, we have 40% of the state's deaths, we have the majority of, or a greater prevalence of folks who are in that at-risk category. That includes folks without homes and our unhoused populations. It includes our Black, Indigenous, people of color populations, and it includes folks living in long-term care facilities. So I'm going to pass it over to Kim Taves, who can talk a little bit more about where we are with contact tracing and also testing. We've made progress in those areas. We've also worked with the state to make sure that they were being measured adequately. But with that, I'll turn it over to Kim Taves.
Thank you. Good afternoon, everyone. My name is Kim Taves. I'm the Communicable Disease Director for Multnomah County Health Department. I go by she or they pronouns. And my team has been working specifically both on overarching testing strategies as well as what folks are referring to contact tracing, which actually has a number of different components in it and is a strong public health strategy that has been used for many years with many different reportable diseases. But right now, the need to stand up a large group of folks and to have that folks have multiple language capacities, as well as technical skills and medical background and epidemiology all together to make a really vibrant team of folks who can respond very rapidly, whether the disease is spread in a work site or in a long-term care facility, whether it's spread through a household or community. We've got the right team of folks to address that. So let me just go over a little bit about where we're at with that. We started out at the beginning of our pandemic with about 7 folks, and they did a lot of the contact tracing for most of the reportable diseases, with the exception of HIV and STD. Today, we've got 45 people. So we've grown our team as the cases have grown. Our ultimate goal is along the lines of 122 to 130 people. And we want to make sure that when we are progressing towards filling those different positions, we not only have the right proportion of mix of people with public health background and with the data or epidemiology background, but as well people who have skills being from or affiliated with culturally specific communities, understand community networks, have experience engaging those communities, and that'll fill out our team. We need to be able to be responsive in an equitable way, and what we've seen in other places in the country as well as locally is that there are some communities that are traditionally a little bit more marginalized and have different levels of access to healthcare in general, who for a variety of longstanding reasons are at higher risk, therefore, for severe disease with this illness. And we've got to make sure that we're taking care of all of our communities. So the goals of the contact tracing system are to identify and interview people who test positive. And that used to be, in our minds, mostly people who had symptoms of being ill. But as we know more and more, there are folks who can have this infection and be infectious to other people, but not have symptoms. So anyone who tests positive, we call a case, and our job is to check in with them, get some information from them, help them understand what their responsibility is in terms of isolating themselves till they're not infectious, and then really wrap around other supports through contracts and very close connections we'll have with community health workers that are based in the community setting to support them and their households and their families to be able to do that isolation. We know that it's really hard for a lot of folks to be out of work for a couple weeks while they become less infectious. We know that they may be missing school, childcare may be difficult for them. They may have concerns about rent, about food security, as well as just concerns about the kind of health information that they need. They may need help with products to disinfect their home, masks or face coverings. So the whole set of services and supports that folks need from people that they trust, understanding what their particular needs are, will be provided in our contact tracing system from the team of folks that will be working through community-based organization subcontracts So those are folks like community health workers, case managers, navigators, or some of the roles that people may be familiar with those people being called. And we need to have the same levels of language capacity and multicultural capacity, both in the folks doing those initial phone calls who will be from public health, as well as the folks who are then they link to for support. I want to talk a little bit about testing briefly. Testing goals, the goals and the priorities for testing have certainly changed over time. I know it's been hard for us, so I'm sure it's been hard for the general public and the healthcare providers as well to keep up every single week with the differences and modifications, both in testing availability, in testing technology and quality, as well as who we all think is a priority to test as we have more and more tests become available. So the goals right now for testing are that we need to assure that to the extent possible, we are moving into a system where we test everyone with symptoms so that we can do that really fast contact tracing and interrupt the spread of disease from one person to another. We need to probably do more expanding work, and I say we there collectively. It's not we, the county health department, it's we as healthcare systems and we as employers need to assure that employees are being screened regularly who are working with vulnerable populations and just by the nature of the work need to work very close connected with them. So we need to make sure that the employees aren't at risk themselves of being infected and that they're not transmitting that infection to vulnerable folks with whom they work. Another goal is that we need to be able to stand up quick, large-scale testing if there is an outbreak. And that may be in a work site of an essential service where people work closely together, or it may be in a place that also has workers but has residents as well. So corrections setting, long-term care facilities, behavioral and addictions treatment houses, shelters for folks without housing. Those would all be sites where there are people who have more vulnerability, and because of their close quarters, either for sleeping or kitchens or bathrooms, could have a higher number of folks affected by an outbreak. So those are some of the overarching goals we have right now of testing. And then our goal in public health is always to ensure as well that there's equitable access. We have a relatively strong system right now of hospital and healthcare systems, as well as community health centers, safety net clinics that are providing testing, and that has certainly improved over the last month. I know prior to that, it was hard for a lot of folks to get testing in places that they're used to getting healthcare. We still have gaps that we need to fill for folks who don't have a regular medical home and maybe don't have health insurance or coverage, or who feel scared and don't have a strong trusting relationship established with the broader healthcare system. So there are some pieces that public health is working on right now with our hospital and our CCO, but primarily especially with our community-based organizations, culturally specific leaders, to identify what are some different alternative test sites, including low barrier drive-through kinds of community test site models and or models that maybe are hosted at culturally specific areas and centers and locations that are not necessarily in a healthcare setting, but could support delivering those kinds of testing services and the wraparound services we need. So that's the piece that we are working on right now, and we're doing that in coordination with the whole health system. I think I'm turning it over to Dr. Vines next.
Thanks. Good afternoon, everyone. Jennifer Vines here, Multnomah County Health Officer. I know you all have questions, and we want to get to those, so I'll just be really brief in emphasizing 3 points that my colleagues have made. The first is caution. So we really want to get this right. We want to feel like Multnomah County is ready to safely reopen, and in particular that it's safe for those most vulnerable. And we know those to be elderly, we know those to be people of color, communities of color, and our essential workers. So caution is the first thing. The second thing is learning, and this virus has challenged all of our assumptions about how disease is transmitted. So we've had to be really agile in our thinking, and this notion that people without symptoms can spread the virus is particularly challenging because it makes it really hard to figure out who may potentially have the infection and just simply not know it. So I want to use that to really emphasize the recommendation for face coverings, which again contain your secretions from your nose and mouth and keep them to you. And again, the 6 foot distance, which we think is the safe distance for potential spread of those droplets. The third thing, so caution, learning, the third piece is trust. And you've heard this word used today in this briefing, but we want people to trust that they can get testing when they need it. We want them to trust the test results. We want them to trust the county public health department or our contracted workers when they call to say that someone has a positive test result, and asks them to in turn trust that person by naming who they've been in close contact with, so we can in turn follow up with those people to make sure that they have what they need to stop the spread. And then finally, we need the county to trust that we have a plan, a safe plan for reopening. And I think we're almost there. But again, as a dense, highly populated and relatively small geographic county, population density does matter. And so I think we have a reasonable plan in place and just need more time to get some of these important components nailed down. So I think with that, I believe we open it up to questions.
I'm unmuted. Thank you guys so much. And we had a few questions come in while you were talking, so let me get to a few of those. Jonathan Bach at the Portland Business Journal is asking, do you think it's too soon for Portland area counties to reopen? Are they rushing?
I think, I am the lead health officer for the Tri-County region. I think each county has been given the authority to make this decision for their counties, and every county has to balance several needs, both, as I've emphasized, safety in terms of COVID spread, but also other needs around their economies or around their particular constituents' expectations. So I would not offer an opinion on the Clackamas or Washington County timeline, except to understand that they, like us, are balancing several different things in their reopening plans.
Similarly, Kelly Azar at K2 is asking, Multnomah County seems to be more strict about where they are before applying to reopen. Is there one big benchmark in particular that would signal we're ready?
I mean, there's clearly a variety of benchmarks that we're looking at, but one of the major things that we're looking at is contact tracing and understanding that when physical distancing is relaxed, that we will have more people sick, and we want to be able to follow up with them in a way that they will trust in a language that they do speak, and make sure that we can do that very quickly. And so we're looking at contact tracing, our workforce there, and then also our ability to follow up with most people within 24 hours.
Thank you so much. And K2 had one more question around masks. Would Multnomah County consider a mandate, requiring for folks to wear face coverings, and why or why not?
Yeah, so this is Jennifer Vines responding. I'm not hearing from our leadership word of a mandate around face coverings, and that's because not everyone feels safe necessarily wearing them. Communities of color in particular feel like they're potentially viewed with suspicion if they have their faces covered. There are also people who, for reasons of heart or lung problems, simply can't tolerate having their nose and mouth covered. I would say in general, though, for anyone who can wear a mask, that's pretty much everyone 2 and over, and who can safely remove the mask. I'm sorry, I'm saying mask, I should be saying face covering. I can make a strong recommendation for using a face covering as an added protection, not only to those that you're coming in contact with, but for yourself. And Multnomah County is developing some more specific information and guidance about how the type of materials and the fitting of a mask can actually offer a fair amount of protection to the person wearing it.
Thank you so much. And K2 and also Zach Morris from Northwest Examiner had a question around how do you get a job as a contact tracer? And along with that, why aren't there postings on the county site for this position?
So there's been a lot of information in the news about skills needed for contact tracing, especially because the work right now is primarily being done over the phone and not face-to-face. People need to have a lot of communication skills. They need to be able to explain health information in a way that's simple and understandable and reassuring. They need to establish rapport and empathy and compassion We've long relied on our team to be highly skilled at making folks feel comfortable to work collaboratively. We don't compel anybody to disclose information. We do that through their goodwill towards other people to help stop transmission of disease, and us being able to effectively explain what our goals are to work together and for folks to build that kind of trust. So it's a combination of a team of folks, like I said, that have a variety of different skill sets. There's some medical records review, and there's some work that has to happen with infection control, prevention, as well as gathering data. And then there's the work to help link people to other services that they may need, help give them information about when they should seek healthcare. There's a broad skill set there, and it's really important to us to have the mix of skills we need on every team. So we're standing up teams that have that mix, and then the teams are modular. That is to say, we'll grow out as many teams as we need to handle the cases, and each team has a combination of those skills within it. So we've been hiring. We've also had medical students and MPH graduate students in the mix as we've needed to stand up. We've pulled in other public health staff. And as we look more towards our knowledge about how long-term this set of folks will need to be working with us, then we're transitioning from some of our on-call positions into more permanent positions, as well as having those skills. I think right now with the process that we go through every year with our fiscal year change, it's important first to look at a lot of our folks in the county who have those language skills and those culturally specific skills, see how programs are changing as we all try to think in new and different ways about what's our model of business and social service delivery. So there may be some capacity there for us to redeploy folks in the county. And then if we do need more positions after that, we will be posting them. We've been working with our union, our multiple unions, and our HR team to articulate what those skills are. And we've created the positions and worked them through just that normal government hiring process that we have.
Great. And a question that we got from Portland Business Journal as well as Zane at the Tribune. So when are we expected to submit an application? Are we looking at June? Rachel? Yeah,
Rachel Banks, unmuting here. Thank you. We have not identified a time frame for when we're expected to submit an application. We've really been focused and working with our chair, Deborah Kafori, and making sure that we're ready and working as hard as we can in getting the components in place that for us to be ready. So we don't have a specific date or timeline that we're expected to submit an application.
Thank you so much. Lindsay at COIN is asking, are you all concerned that people will be going to other counties if Washington and Clackamas reopen? Dr. Vines, maybe?
Sure, I was looking at Rachel. I think, so certainly going county by county is going to create circumstances where one county may be open and the neighboring county may yet to reopen. We've all acknowledged in the metro area that that's going to be potentially difficult from a communication standpoint. So the 3 metro counties, I think, are doing our best to stay aligned on this. But again, you see Washington and Clackamas moving along a somewhat different timeline. So that certainly does raise the possibility that people will be crossing county lines for their services. And again, that'll be part of the learning and part of the adjusting that we'll be doing as we look at our plans for reopening.
Great, thank you. And sorry. We did get a question on what the timeline is. Sorry, just going back to the question around hiring. How long will it take to get all these folks on board, Kim?
I think our goal is not to hold off on submitting a reopening application until all those positions are filled that I discussed. Our goal is that we are on a pathway towards growing with a very specific plan that we can express to the governor, and that we are there enough in our growth that we're keeping up with our current case counts that we do have. And we need, especially I think right now, to work on some of the mix of staff that we have that have multilingual capacity. before I feel like I, as the communicable disease director, would give my green check in the box and then raise it up to the chair and to Rachel Banks, our public health director, to review. So we do have some pieces there that are important, but that need to be in the mix of every single team. But we don't need all the teams in place to open. I think that the governor has stated, and I've seen in other folks' plans, that they just need a clear pathway, a trajectory, contracts being put into place, training plans in place, etc.
Pat Doris with KGW just had a follow-up question on kind of on the application submission. We've got hundreds of thousands of people waiting for these reopening plans. How can you not at least pick a date to submit that application?
So this is Rachel Banks, and once again, we are working with our chair, Deborah Kafori, and really feel that from a public health. Well, first of all, I want to acknowledge. I guess I should back up and acknowledge that we understand that there are hundreds of thousands of folks in our county who are impacted, and really and understand that reopening could impact so many people. And so we're balancing from the public health side, really wanting to make sure that we have protections in place, that we're keeping the public's trust by not artificially setting a date, but by sharing, more importantly, where we are making progress, and where we are meeting those benchmarks and how we're progressing. So, it has to do, I think, with wanting to be transparent and to meet expectations, and to say we're moving as fast as we can to safely reopen.
Thank you. And then Blair with the Mercury had a question. Because Multnomah County is so dense, are you considering requirements above what the state is doing? For example, temperature checks outside of busy buildings, or a higher rate of randomized testing?
Yeah, so this is Jennifer Vines. I'll take a stab at that. As far as those two particular interventions, I would say we haven't specifically talked about those. You will see that on paper, we appear to have plenty of testing capacity across the region, but we're working hard to make sure that really everybody feels like they can get a test if they need it. And there's still some gaps in parts of our county that we need to make sure are filled. I think to the question of whether we're holding ourselves to a higher standard because of our density, I think our chair and Director Rachel Banks can speak to this as well. I think we've tried to really be transparent about where we are holding ourselves accountable for a safe reopening.
Thank you. And Zach Morris with the Northwest Examiner again. Does the city of Portland agree with your timeline and the extra criteria that Multnomah County has set above the state requirements for applying for phase 1? And
So Rachel Banks here. Not going to speak on behalf of the city, but I can say that in the conversations and planning we've had thus far, the city has also prioritized equity in their response efforts, as well as wanting to understand what's in the best interest from a public health perspective.
Great, thank you. And Kelly from K2 had a question following up about testing at businesses. With so many people being asymptomatic, how are we truly protecting people in businesses if so many people can be walking around without having any symptoms at all?
This is Kim Taves, Communicable Disease Services. The capacity that we have to test right now, we being the whole healthcare and employer and public health system altogether, isn't such that we can test all humans, all residents in our population every week or twice a week, which is the kind of testing that we would need to be able to stand up to catch every single case of someone who doesn't have symptoms but is moving around. And because we don't have that capacity, that's why, as we became aware of the asymptomatic folks who can be infectious but not have symptoms, it just further re-emphasized for us that the choices that we were all making with creating different ways that business can open and have employees work teleworking, rearrange the work site so that there's 6 feet of distance, just is absolutely that much more crucial, as well as face coverings, as well as hand hygiene. Those pieces are the pieces that all of us use to protect ourselves and each other when there are people moving through society, which will need to happen because we can't maintain ourselves in this suspended state of full quarantine forever. Those are the pieces that are so important that to stop the transmission of disease. Testing in and of itself won't be it. I know that people are interested in a different kind of test called an antibody test. And that's a test that doesn't say someone is infected right now, but it says that someone at some point in the past has been infected. It's a sign that the immune system recognized that virus in the body and created a response to it. When we know more information about whether or not having had it before protects you from infection again in the future, and if so, how much and for how long, then we may have some more information as well about what role that kind of testing can play to help people understand who has some immunity and who doesn't. But right now, the science that we have is not clear enough that we can make policy decisions based on that.
Thank you. And one follow-up on that from K2 was, is there a plan to test contact tracers, and how often would they themselves be tested for COVID-19?
So the contact tracers we have are doing the work primarily through phone with all the same safety considerations in place for distancing when able and communicating and connecting in more of these virtual ways that can be very frustrating for all of us, but we're learning how to do. We have had texting and emailing and phone messaging as a key way to establish contact. In the past, we only for very serious illnesses where we were really concerned and not reaching someone did we move to going to their house. Sending a letter right now is a little bit too slow for this disease, although it's appropriate for other diseases that are transmitted as quickly. The folks in the community that are community health workers, they'll have safety protocols as well. If they need to bring over supplies, need to drop off food, they may be using phone or texting or video chat for sharing information, but if they need to show up and bring someone something that's isolating in their home, then they'll have those same precautions in place that we're giving everyone in terms of wearing a face covering, texting or calling someone to say I'm at the door, putting the stuff on the doorstep or the porch, standing back at the sidewalk so that they're more than 6 feet apart. We won't be asking anyone to do the work of supporting families by going into their homes, for example. When our own staff need to go into a facility that may be having an outbreak, then we make sure that those staff have that same kind of personal protective equipment that's required by OSHA for the setting and is hopefully the same kind of equipment that the staff in that place of employment also are already using.